Hi, I'm Jennifer Brown, a student for NU 650 at College, and this is my volunteer patient, Christy Deptula. Do you give verbal consent to being recorded?
Yes.
This is the musculoskeletal assessment. And so you start as the patient comes into the exam room. You want to evaluate their gait, any weakness or unsteadiness in their gait, and any obvious deformities in your physical assessment. You would start from head to toe in this sense. And so I'm going to give you some instructions on how to move your head and your neck. So first it would be checking the jaw joint. Go ahead and open your mouth and close again. Wonderful. And I would like you to bring your chin to your chest. This is checking for flexion and curvature of the spine. Go ahead and look up towards the ceiling. Wonderful. And you're going to look over your right shoulder and over your left shoulder. And then I would like you to drop your ear towards your shoulder on one side and then again on the other. And so in moving forward in the video, anything that I would assess or perform on the right side of the body would then be on the left side of the body, as far as range of motion, any tenderness or swelling in the joints. In moving forward, I'm just going to concentrate on the single side of the body for educational purposes in making the video. From the neck, then we would move down to the fingers. We start at the fingers, check for abduction and adduction, any kind of swelling or deformity of the joints, which could be indicative of rheumatoid arthritis or arthritic process. And there's nothing of concern here. Then we look at range of motion in the wrist, so flexion and extension, and then abduction and adduction. Make sure that that wrist joint is fluid in movement. Here with the elbow, we have flexion and extension, and then we have pronation and supination, and that's the only two movements in the elbow there. Moving up to the shoulder, you can assess for the connection at the scapula and clavicle by placing your hands and feeling for the tuberosity there. Here, the shoulder has multiple points of flexion and extension. So I'm going to have you raise your arm, palm facing up to the ceiling, and then down and behind your body, which is your extension. Your abduction and your adduction will be across the chest that way. In looking for signs of injury or concern, one of the tests that you can do is to place some gentle pressure on the scapula, have the patient raise their arm towards the ceiling on their own, and then very slowly bring their arm down. If at any point there's a sudden arm drop, that can be an indication of a rotator cuff injury and would need to be evaluated further. Also, there's a couple of concerns when it comes to the wrist for both carpal tunnel syndrome, and there's two ways to check for that. One is to actually palpate the median nerve of the wrist, and if the patient reports any pain or tingling to the finger or the palm, that can be an indication of carpal tunnel. And then I'd like for you to put the backs of your hands together, and I want you to push your wrists together. And if the patient then also had any pain or tingling from the hands to the fingers, that could also be an indication of carpal tunnel. Moving on, we'll be looking at the spine, the curvature of the spine, being able to palpate each vertebrae and make sure that there's not any step off, which can be an indication of a disc out of alignment there. The patient should be able to stand up and touch their toes, bending at the spine so you can see the curvature of the spine. Moving forward, it will be the knees. You have flexion. Go ahead and lift your toes towards the ceiling, and extension. Making sure to palpate the patella and make sure that there's no ballooning or bulging at the knee, that there's no pain there, and that there's full range of motion and no swelling to the joint. And then also for your feet, flexion and extension, they'll point toes up towards the ceiling and then point toes down to the floor. So full range of motion, inspecting joints for any swelling or tenderness, watching the patient go through active range of motion. If there's any grimace or concern on their face, to certainly evaluate those joints.